Hi everyone and welcome. My name is Sigal Barnes. I am Director of CLE Production and a Program Attorney with Lawline.com. I'm welcoming you today to our program Disorder in the Court, Understanding Personal Psychological Injury. I'm here today with Dr. Mark Lerner. He is a forensic psychologist. He is an author, speaker, and an international traumatic stress consultant. Welcome, Mark.
Good morning.
Good morning. Thank you so much for joining us.
And thank you for having me here.
So it's my pleasure. So one of the reasons why I thought it was very important for us to speak today is traumatic stress, personal psychological injury of many different kinds is very, very important to the legal industry. It's very important to the legal industry in a variety of different factors. First and foremost, it's important because it's when you're representing a client, whether they have some sort of injury, whether you're actually defending in one of those situations, as well as within your own legal practice, your own type of traumatic stress, as well as dealing with other people within your legal practice that have that. So I'm really happy that you're here today. I feel like it's very important, and you'll be able to shed a lot of light as to what traumatic stress really is. And I guess before we begin, if you can just provide us a little bit about your background and area of expertise.
Absolutely. Well, thank you for having me here on Lawline.
Of course.
My background is as a clinical and forensic psychologist. Starting out a little over 20 years ago now, when I started out in practice, I had what we would call a general practice. Shortly after starting out, though, I had a referral for somebody that was all over the news. It was a very high-profile, very traumatic incident that really taught me very quickly in my involvement in this matter that I had to have some special knowledge and training in this area. In fact, I remember Primetime Live was contacting me at this particular time because the case had such notoriety. Shortly after my work with that case came the Oklahoma City bombing. And I remember reading in the news about how before the caregivers could go home to their families, they needed to be debriefed. And I remember thinking, who are these debriefers? Who's doing this kind of work? And what I did was I set out to establish some standards among people that worked regularly with survivors of traumatic events. I started some organizations that dealt with that, and I've committed my career for the last 20 years for doing that. Most recently, I'm involved now as chairman of the Institute for Traumatic Stress, where we're trying to provide practical information and standards for people who are living through challenging experiences.
If you can just tell me a little bit about the difference between, I know that there's a forensic consultant and a forensic examiner, and I know you work with this. What's the difference between the two?
The difference between consultant versus examiner is often the difference between paper versus person.
Okay.
The consultant may, in my role as a forensic consultant, review documentation and help attorneys to be able to prepare for a cross-examination, for instance. Be able to guide them in terms of some of the review of the data that we have, perhaps from other mental health providers or facilities. Whereas a traumatic stress or an evaluator, if you will, I'll work directly with the client. I will interview that client, review documentation, perhaps administer some written tests to be able to provide some objective data as well.
And I mean, does it really mean, like a forensic consultant, for instance, you're reviewing data for the attorney, whereas the forensic examiner, you're specifically examining the client, you said? So in those situations, is it very specific to plaintiff or defendant, depending on what?
Not necessarily. I've worked with both plaintiffs and defendants, and what's important here is to be able to provide the legal community with information and an understanding. Doing it as a consultant, I can review mental health records, whereas as the examiner, I'm privy to actually meeting with the client directly and also having that data to incorporate as well.
Interesting. Okay. And if we can go a little bit to looking at what a traumatic event actually is, and what is a crisis, and I mean the difference between it. Is there a difference? If you can talk a little bit about that.
Absolutely. A traumatic event, by definition, is an event that overwhelms our ability to cope and to problem solve. Traumatic events are typically unexpected, although not always. We certainly knew that Hurricane Sandy, for instance, was coming toward us. Mm-hmm. But oftentimes unexpected and, most important, unwanted. They overwhelm an individual's ability to cope and to problem solve. The other, you had asked me traumatic event versus
crisis.
A crisis. A crisis is not so much the event, but if you will, the human response to an event.
Okay.
A crisis often is the emotional overwhelmingness that a person will experience in the face of that traumatic event.
Interesting. Okay, and how do people usually respond to traumatic events? I mean, they definitely experience a crisis, but what are some of the ways that people actually do respond to these kind of events?
People respond to traumatic events very often with traumatic stress reactions, not to be confused with post-traumatic stress disorder. Traumatic stress, by definition, refers to one's feelings, thoughts, actions, physical, spiritual reactions when they're exposed to, or even when they witness events that overwhelm their ability to cope and problem solve. Not necessarily everybody goes on to develop PTSD, post-traumatic stress disorder, a serious psychiatric condition.
Now, so traumatic stress can evolve into post-traumatic stress disorder, but post-traumatic stress disorder does not necessarily mean that everyone the traumatic stress has that. Is that correct?
Good point. You know, one of the things that we're all seeing today is anytime that there's a highly publicized event in the news, there's a rush to label people. We start hearing immediately about post-traumatic stress disorder. I think that people do this in an effort to gain back a sense of control that adversity seems to have taken away. Rather than rushing to label people, I think what we should be doing is looking at these reactions as traumatic stress reactions, normal responses to abnormal events, and reaching people early on with timely information and support.
And I mean, just so we can put a face on some of these. I'm sure that the possibilities are endless. But what are some traumatic events that people actually go through that you've actually seen within your practice?
When people think of traumatic events, and just to digress, when family and friends just hear of an event in the news, I'm so frequently asked, Mark, are they calling you? Will you be responding? Right. And yes, the plane crashes, the terrorist attacks, the bombings, war, hurricanes, these are certainly traumatic events. However, traumatic events also occur every day in our own backyards. People that are living through a horrific divorce and custody battle, a caregiver crisis, caring for an elderly parent, somebody who's been sick or injured, just received a diagnosis of cancer. There are so many events, personal crises and traumatic instances that color people's lives too.
Okay. And as far as these traumatic events and the responses that we have to them, in certain situations where, let's say, and I'm going to veer off a little bit, but I'm just curious, in certain situations where, let's say, you're dealing with somebody in a divorce action where, they're dealing in situations where they're going through a lot of stress. It's a very, very hard time in their lives. From an attorney standpoint, speaking to their client, what are some of the things that you could maybe recommend as good ways to deal with knowing that somebody's going through these type of things? Or what are even some of the responses that you can identify as an attorney that's in order to help your client kind of move through this system a little bit easier?
Well, it's a great question. As attorneys, the importance of facts is so critical. Mm-hmm. But we have to recognize that when people are living through, such as in a divorce action, there's also some very real emotion that could certainly color perceptions of facts. Mm-hmm. And with that said, I think the first thing that attorneys need to do is be aware. To be aware of the feelings behind your client's words. It's not just what they're sharing with you, it's what's going on the inside that they may not be sharing with you. And also to recognize the impact of, and we talked about this even before the program, of when we work with people who've been through traumatic events, we're being exposed to doses, daily doses oftentimes, frequent phone calls of the pain of our clients. And it does have a vicarious impact on ourselves.
Interesting, okay. And in general, in your experience, what kind of legal cases do psychological injury frequently center around?
There's a wide gamut, because when we look at a person who's psychologically broken, if you will, or has experienced traumatic stress reactions, it can be the highly publicized events that I talked about, but it can also be motor vehicle accidents, it can be malpractice instances, it could be family law issues. Traumatic events can be of all different kinds and types. I've often said that a crisis is in the eye of the beholder.
Right.
So what's a traumatic event or a crisis for me may not be for somebody else.
Interesting. And in your experience, there's so many, you're right. I mean, yeah, it's just limitless how many types of traumatic events you can go through in legal situations specifically. But what are some of the common obstacles that you've seen in proving psychological injury in, let's say, the courtroom, specifically as a witness, let's say for the plaintiff? Let's start with the plaintiff.
Well, one of the most difficult challenges is proximate cause, the direct cause. A plaintiff in a case can build a case around the fact that something horrific or horrible has happened to their client, without really exploring and knowing the person's background, for example, and knowing that there may be another reason or other reasons that that person is experiencing significant emotional distress.
So when a client comes to an attorney and says, listen, I have this case, I am psychologically injured by this specific event, I feel like I need to sue, and I need to ensure that I'm properly given the money that I need in order to help with my damages, you're saying, and correct me if I'm wrong, but you're saying the attorney needs to be very wary of the fact that proximate cause is a very big issue in proving the case for this plaintiff, and to really take the time to really understand where the plaintiff is coming from to ensure that there aren't any mitigating factors that are actually contributing to their damage.
Exactly. To not only know what has occurred, but what was done to address some of the things that may have occurred in a person's life. Has this person been involved in some kind of counseling or therapy? Has the person taken some psychotropic medication in the past to address some of that? Because if this were to unfold without the attorney being fully aware, it could be very ugly in the legal setting. So it's very important to, in a sense, do your homework and understand that what the distress that a person is alleging is truly being caused by the precipitating event that the person's presenting.
Interesting. And in those situations, is that where you as a forensic examiner would perhaps come in and to ensure that you understand the client in that sense and understand where the client is coming from in order to ensure that the case can actually move on? Or is that
exactly?
Okay.
Exactly. Not only as a forensic examiner, but in many cases, even as a consultant, being able to review, in these kinds of cases, we're privy to records, the full medical records of the client, and to be able to look back at those records and say, well, this happened, and how are we going to address that in the legal setting? Very important.
Okay, interesting. And what about on the other end for the defendant? If you're brought in as a consultant or as an examiner for a situation where someone is being sued for causing psychological injury, what are some of the things that you think? What are some obstacles for disproving these psychological, or the proximate cause, I guess, for psychological injury?
I would respond to the question the same way. I think it's the same. It's critical to be aware of what this person has experienced in their lives. Case in point, I recently testified in a very highly publicized matter where the proximate cause could very well have been the event that the person was suing about. But in this particular case, it turned out that when we started to explore the person's childhood and family and background, there were other highly significant traumatic events in this person's life.
Wow. Okay. And are there ever any times, I guess, throughout these legal cases or in your experience, that you've seen actual physical manifestations of psychological disorders that will actually better, I guess, help in legal cases to assess and quantify damages?
I can, and I certainly have. One of the things to keep in mind that is, if a person is physically harmed, there's a greater likelihood that they're going to have a traumatic stress reaction than somebody who hasn't been physically harmed. The reason being that is that there are constant cues, reminders, that physical pain, if you will, that constantly presents and reminds the person that, of what had happened, making it difficult for them to separate from the event itself.
And when you say physical pain, I mean like headaches, stomach aches, like chest pain. I mean, how do you?
Well, for instance, if a person has had a back injury, it's certainly not unusual to feel chronic pain.
Right.
And that experience of pain will remind them not only of the physical aspect of it, but the emotional. They may very well experience some repetitive recollections, disturbing recollections of what happened, have an inability to sleep, maybe even flashbacks. Flashbacks, by the way, is the actual feeling that I'm living through it, as opposed to the recollection, which is just kind of reminding oneself or remembering, if you will.
Interesting. And so in certain situations where you're physically injured, it could actually create a traumatic response, or it can create a psychological injury of a sort because you're responding to that physical injury. But in situations, have you seen where the injury is purely psychological and then there's a physical manifestation from the psychological
Great
injury?
question. And, you know,